So I'm thinking of some challenges here. I'm sure there's professionals who are listening, and we all face some difficult things because
Yes.
the the concern here is coming across as if we're invalidating the seriousness of the condition. I think a lot of people come in to see us, myself as a clinical psychologist, yourself in your work, is that they've already been invalidated by the medical system. Some will say, oh, well, it's all in your head. They might not be taking it seriously enough.
Yes. Yes.
And then we're talking about this approach where we're saying, well, it's complicated, and your internal appraisal of the event, how you view it, how you think about it, your response to it is critical here, as well as looking at other aspects of your life and how you respond to them. But they're not wired to view it that way generally. They view it as a medical condition separate from them, right? It's like something that
Happened to them.
it happened to them. The doctors uh, reinforce that. Many view it's genetic in some way, which communicates it's outside your control. How do you find this balance between validating the suffering, but also trying to inspire and motivate to change your way that you respond to it?
Yes. That's an excellent question. I have a few answers to this. And one of them is by the time people find me, they're desperate and nothing else has helped them. Because unlike psychiatric conditions or alleged psychiatric conditions, there isn't treatment that supposedly works. There is no pill they can take. There is no rehab that will help them manage their condition. They are told there is nothing that can be done for you. Good luck. And as horrific as that is, and as much as that, as I'm even just saying the words to you, I can feel my heart just sinking into my stomach. It fills me with this rage of injustice. At the same time, in some ways, that's the saving grace because the the biomedical paradigm does not have anything to offer these patients other than pills that sort of manage their conditions sometimes, but don't really. If they worked, or if people thought they worked, they wouldn't be looking for information on the internet about it. So that's part of it. So to sum that up, it's by the time people find me, they're miserable. They've tried everything else and they're like, well, what the heck? I guess I may as well try what she's saying. I might be nice. Maybe I'll be nice to myself and I'll do this 10-minute meditation and see what happens. That's also why, Roger, I do so much of what I do for free. So I do a lot. I mean, I've put out weekly YouTube videos for years now. I have a free course that's very comprehensive. All of that is because I think it speaks for itself, and people have very good reasons not to trust me once they've been gaslighted to the ends of the earth by a whole bunch of people, medical providers and others. So I say, you don't have anything to lose by trying this. I give them the evidence. I say, this neuroscience makes sense. What I'm saying makes like complete sense. But you don't even have to just trust me on that. I want you to try this. Just try this and see how it goes. And if it works for you, then let's keep talking. And if it doesn't work for you, here's some other things you can try. I think presenting the information and having people be able to access that information without needing to invest monetarily is a very big part of that. It earns people's trust. And I think it also demonstrates to people that I really believe in what I'm talking about. So they know I'm not asking for anything in return other than their attention for 15 minutes while they watch a YouTube video. So again, for people who often have very good reasons not to trust people, both because of their experience within the medical system, but also often, as we talked about, as the result of experiences that occurred long before symptoms ever started, they can see that I might be someone who has good intentions and is trying to help. So I think those are the main components of how I reach people. The other thing is the provision of absolute proof that it works. just as you said, I don't frame things in terms of guarantees, but I give people success stories and I share constantly, I share anecdotes. I mean, the success stories represent the tiniest fraction. My YouTube channel is full of comments from people who've gotten better and who've seen improvements. It's overwhelming proof to people that there's something to what I'm saying and that there's hope. And once the door is cracked open, once there's a little bit of hope and people are willing to try, then they can be helped.